Namaste friends, I am Dr. Avinash Kumar Singh, a practicing hemato-oncologist from Patna, Bihar, and today I will share with you all about platelets, how to increase platelet count. So as you all know that platelets are very important component of our blood, which is a vital organ in our body. Today we will discuss about what are platelets, what are their function, why there is low platelet in any human being, what are the causes of low platelet or thrombocytopenia, what are the myths involved, how they present to us, what are the symptoms, signs, how to diagnose them, and if there is low platelet, then how to treat them. So friends, platelets, as I have said, is very important component of our human body. It's a part of blood, which is a liquid organ in our body, and it controls bleeding. So other than controlling bleeding, it has lots of function in our human body. But for general people, it's important to understand that platelet helps in clotting or controlling bleeding. So whenever there is low platelet, there is risk of bleeding. But why it is important to discuss about platelets? Because there are so many myths involved with low platelet or thrombocytopenia in our society, which is not justified. I feel in my practice that many people, many patients, their family, they are very scared of low platelet count, which is not justified always. So the normal platelet count in human body ranges from 1.5 to 4.5 lakhs per cubic millimeter, and so it has got wide range, and it's very important to know the correct platelet count. We need to do manual platelet count. So always there is difference from what we got from Coulter machine and what we get from manual platelet count. So the correct estimate of platelet count is manual platelet count. So whenever you get your platelet count done, or when you get CBC, always ensure that you get manual platelet count, which is the correct measure of a platelet status, whether it is low, normal or high. So whenever platelet is less than 1.5 lakhs, we define that the patient is having thrombocytopenia. But recently the American Society of Hematology guidelines, they have suggested that even more than 1 lakh platelet, if they are stable, it doesn't varies for more than 6 months, we can consider it as normal. So if platelet is less than 1 lakh, it is falling or trend is of fall, then we evaluate them. We consider them as thrombocytopenia and we evaluate them. What are the common symptoms of thrombocytopenia or low platelet count? Most of the patients, they don't get any symptom if platelet is more than 30,000. So it's very important. If suppose someone has 60,000, 70,000 or 45,000, do not get scared, because when platelets are less than 30,000, only then most of the patients will have symptoms. What are the common symptoms? You may get some purpuric or petechial spots over your body, over skin, inside your oral cavity, that is called wet purpura. You may have bleeding from nose like epistaxis, gum bleeding, hematuria, bleeding PR, blood with stool. And sometimes when platelet is very low, like less than 10,000, or if there is some other risk factors for bleeding, one may have bleeding inside the cranial cavity, that is called intracranial bleed, which is fatal, which may be fatal. So it's very important that all thrombocytopenia is not dangerous. All low platelet count are not dangerous, but we need to know the cause of low platelet count. It's very important. We will discuss about common tests that we do for diagnosis of low platelet count and the treatment involved in second part of this video. Thank you. Thank you everyone.